Hi guys, as you know, we are meeting today to discuss the outbreak of our patient who came in with measles.
Yes, this is a very unfortunate case as it could have been prevented.
We need to get to the bottom of this so we can have better communication amongst our healthcare team to prevent this from happening again.
So, to briefly go over the problem, Miranda, 8 years old, came to the clinic with a fever, cough, and rash. I checked her vital signs and did an assessment on her when I noticed the very evident Koplik spots in her mouth. After giving my findings to the doctor and talking about the patient, she ordered a blood draw to test for IgM antibodies. Miranda tested positive for these, and therefore we could conclude that she has measles. When looking over Miranda's chart, we noticed that she did not get her booster of the MMR vaccine. We asked her mother about this vaccination, and she was under the impression that Miranda had received the vaccine. What her mother didn't know was that she needed a booster for the second dose.
This is very serious. We know how contagious measles is and the epidemic that is happening right now everywhere. According to the CDC, from January 1st to October 3rd of this year, there have been 1,250 individual cases of measles in 31 different states.
The CDC does tell us how contagious measles are. Did you guys know that measles is also contagious, that if one person has it, up to 90% of the people close to that person who are not immune will also become infected? This disease is simply spread by coughing or sneezing, and the bacteria lives in the nose and throat mucus. It can live up for 2 hours in airspace where the infected person coughed or sneezed. We all know how herd immunity can save lives. If we are not properly educating or reminding our patients about follow-up vaccinations, this problem can continue to happen.
I was reading some literature the other day about how to keep your patients up to date on their vaccinations. I read an article titled "A Qualitative Evaluation to Explore the Suitability, Feasibility, and Acceptability of Using a Celebration Card Intervention in Primary Care to Improve the Uptake of Childhood Vaccinations." This was written by Wemby, Green, Tana, Connor, Valor, and Barnes. Currently, there's a program called the Celebrate and Protect program. This program is partnering with many countries to improve the uptake of childhood vaccinations through the use of celebration cards. These cards encourage attendance for vaccinating and enhancing relationships between providers and parents of children.
Wow, that sounds like a great idea. I think that if she would have been properly educated and reminded on the booster vaccine, we could have prevented this outbreak from happening.
It sounds like we've gotten to the bottom of this situation as why this has happened.
The next step for implementing the reminder cards is to bring this evidence to the office manager to show them how we can prevent a disease outbreak that could be prevented from vaccinations from happening in the future.